My name is Melissa Teply. I grew up in Omaha, Nebraska. I went to medical school here at University of Nebraska. And after medical school, I went to the University of Michigan in Ann Arbor for internal medicine residency. Following that, I was in practice in primary care in Baltimore for 3 years, and then decided to pursue extra training in hospice and palliative medicine at Johns Hopkins University. So I grew up in Omaha. I have such a strong sense of home and sense of place in Omaha. I've lived in various parts of the Midwest as well as on the East Coast for a time. And this is the place that I'm always the most excited to return to. This is a place that is big enough to be interesting, but still small enough to feel a strong sense of community. In both my practice of primary care and in palliative care, the fields rely most heavily on building relationships. So I know the tests and treatments for various conditions, but that can only go so far. In order for me to best treat a patient, they need to agree with the recommendations that I'm making. In order for me to make those recommendations most effective, I have to have some understanding of what their hopes are for their health and what their concerns are about the issues that they're facing, so that I can best personalize a plan of care for them. So in my primary care practice, I tend to see patients who have chronic conditions such as high blood pressure, diabetes, and other conditions like depression and anxiety. I also really enjoy working with patients to make sure that they're up to date on their preventive care, which includes vaccinations and cancer screening. In my practice with palliative care, it's a field that's directed toward helping people who are experiencing bothersome symptoms, as well as the stress that can happen with having a serious illness. And so in that field, I work a lot with patients who have cancer and patients who have advanced heart failure, advanced COPD, to provide an extra layer of support for them as they're experiencing their illness. I kind of always had an inkling that I wanted to become a doctor. I've always been drawn to science and the human body and knowing how it works, and especially learning more about an illness that a person has and the treatments involved. But what really is fun and challenging about medicine is working with a person as they're going through that illness, working with them in discussing what to expect from that illness, and then also trying to make a plan for when unexpected issues arise.